we're podcast crew. We've got a turnkey podcasting studio in Robbinsdale.
Okay.
And so we are kind of taking our show on the road. We do this like a Costco free taste test, if you will. We want everybody to get the chance and experience to be a part of a podcast.
Yeah.
Our podcast is called Spotlight. So it's really about taking 15 minutes and focusing that spotlight on you. So what I would like to start with is, why don't you tell me who you are and what you're up to?
Sure. I'm Emerson Villalta. I'm been in the U.S. actually for only 3 years.
Okay.
I've been living in Minnesota area for 1 year. I came to study here. I go to Cornell for food science, and then I'm here for some reason. But I love the cold here better than Ithaca.
Is that right?
Yeah, it's very tough.
Ithaca is also Minnesota?
No, Ithaca, it's in New York. It's
New
not
York.
upstate
New
New
York. Okay.
So
It's why do you like the cold here better? I wonder.
I think it's about like it's drier and it's not as windy.
Okay.
I went last year because my partner's still over there, so I got to visit very often, and I felt much more colder there than here.
Wow.
And it's much snow than here. So
There's more snow in Ithaca?
yeah.
Wow.
Last year at least, it was apparently I was told that it was significantly a mild winter here in Minnesota. So
It was, yeah.
yeah.
So we moved here. The two of us moved here in 2013. It was like the worst winter we'd ever had.
Oh.
And we moved here from the Middle East, which is one of the hottest places in the world. We lived in Qatar, where it could get up to 140 degrees in the summertime, like ridiculous, right? You have to pour water onto things to be able to pick it up.
Oh, Jesus Christ. My gosh.
Pretty opposite. And we moved here, so we have 4 kids, and I still had work in the Middle East. And so I basically hopped on a plane very shortly after I dropped my wife off here in the U.S. And she's here by herself raising 4 kids in the worst winter that Minnesota has had in many, many years. And so, yeah, she was cursing me out for a year.
And now she's the CEO.
Yes, exactly. She definitely keeps me in line after that one.
Yeah, I would.
Awesome. So what really brought you to Minnesota specifically then?
Well, for work first. And then I started getting into the startup scenario here, and I'm right now working on a startup myself.
Oh, yeah. Nice.
The name of it is Harmony.
Okay.
So we're building the infrastructure to help families with a loved one with a rare disease.
Okay.
To help them manage their health journey, trying to unload all the burden that they face. Most often you will see them carrying a big, thick binder because our health system is very fragmented. So in order for them to actually get insights, understanding what the rare disease that their loved ones are suffering, they need to do it themselves. Like they need to go to all the doctors, require filled up a form to request all of their electronic health records and print it out. That's how things are done today. So when I'm trying to build,
still today in 2025.
even still today in 2025.
Wow.
But now since the 2020, there was the first Century Cures Care Act that was enacted, and that has been enabling interoperability between health systems. So thanks to that push, right now there exists APIs that third parties can access on a patient's behalf to actually get that electronic health record in a digital way. Okay. So I'm leveraging that to build a place for their caregivers to have the patient's data in one single place, streamlined, and building tools around them to help them manage their rare disease.
That's a pretty fascinating space to be in. Is there
Yes.
is there an underlying reason, an inspiration that got you into this particular type of business that you can talk about?
I was at a lecture at Cornell, and there was this entrepreneur that was telling us her journey, and she was mentioning how hard it was for her to democratize health data back in 2010s, and that really inspired me. And as she was talking all of it, I was thinking like, we have AI systems now that can understand pretty much anything that you put in them. And also I read about the Cures Care Act prior to that conversation. So I was like thinking that we are right in the moment right now to actually deliver better experiences for people to manage their own health data. So far you can manage your financials, you can manage any part of your life but your health data. So I'm trying to change that.
Wow, it sounds like a really exciting space to be in. Like
Yes.
you're on the bleeding edge of something that should have already happened, but
Should have
hasn't.
already happened, yeah, yeah. There's a lot of legacy systems still in place but slowly but firmly we're moving towards that direction on interoperability and digitalization in the healthcare system.
So where are you in your journey? It sounds like you're past idea stage and
Yeah.
you're in some
We're building our MVP right now.
Okay.
We are connected to the two main providers of health systems, Epic and Cerner. Between the two of them, they have 85% of the market.
Okay.
So they provide the health system for hospitals, clinics, all of the medical institutions. So, and they finally delivered their APIs last year. They're making it harder. Their APIs are not easy to deal with.
Is that right?
Yeah. But we're working to have by the end of next month having connections to both APIs and summon people's data easily through our app. So once we have the MVP, we will be ready to start scaling up that infrastructure and possibly partner up with the Center of Excellence here. We have one here at Mayo Clinic that does a lot of research on rare diseases. They have specialized teams, and we want to partner with them to help those families. Like I understand the journey is it's a lot. It's a lot to take in for someone alone, and sometimes it takes over 5 years to get you even diagnosed with a rare disease.
Wow.
So we want to reduce that. We want to make it faster for them to get diagnosed and help them throughout their entire journey through our app.
You said we many times. I'm curious, like how big is the team? Who's on your team?
Yeah, where I know I have a CTO, a software engineer. He's developing the back end and front end of our infrastructure, and I have a data scientist as well to help us. What we want to do after that is also building the best data sets that pharma businesses or biotech companies need to further the research on these rare diseases, because they need data, they need valuable data, and unfortunately it's scattered and it's fragmented, it's sometimes siloed in one hospital. So we need that data to be able to reach those researchers that are working towards making solutions for those rare diseases.
That's awesome.
Yeah.
So obviously you're part of Startup Week.
Yes.
Is today your first day, or have you been here all week? Or
I've been here all week.
Okay.
I'm also volunteer, so it's
Nice.
been a great week and great experience. This actually has opened up my eyes of like what Minnesota has to offer for startups. Like I was very impressed that the startup ecosystem here, it's very neutral. There are fantastic ways for you to connect with people that put you in the right path towards where you want to be as a founder. You can meet investors, you can meet partners. I met this amazing guy, and he was showing me to a lot of people in the healthcare system here in Minnesota, and I got like 10 people that I need to reach back right away after this week to build this. So people are excited. People know that AI is about to change the game, and democratization of funding for startups is happening too. It's no longer only consolidated on San Francisco. You can build something anywhere now. And I'm happy that Minneapolis is definitely going to be at the forefront in the future for startups.
Awesome. So I'd like to wrap these up, and your whole thing you got going is very inspirational. Well,
Yeah.
I'd like you to just give us, the audience, one piece of inspiration, one thing that keeps you going every day.
Wow. I think what inspires me, it's helping people. Like I see we're going through a difficult times right now as a country, but as long as we keep together, we keep working together, we keep understanding each other, I think we can find solutions for the most pressing challenges that we face as a community right now in the U.S.
Awesome.
Yeah.
That's it, man. Thank you.
Thank you so much for having me.
It's been cool.